So as I was saying, for this particular drug class, it affects the DNA through the entire life cycle. So it works on all phases of the life cycle, and different chemotherapy drugs work on different phases, but this one works on all of them. So one common side effect that you'll notice with a lot of these chemotherapy drugs is pancytopenia, which is a combination of anemia, thrombocytopenia. So we're looking at low hemoglobin, we're looking at low white blood cell counts, we're looking at low platelet count, all of those. So that is the most concerning side effect of all these chemotherapy drugs, is that pancytopenia, especially the low white blood cell count, because that person is going to be at a very high risk now for any type of infection. A lot of times when people die from cancer, it's actually from the cancer treatment and not necessarily the cancer itself. And it could be from that chemotherapy treatment and that low white blood cell count, that they just get an infection that they're not able to fight off. So we really need to be careful with them. We need to teach them good hand washing. We need to make sure that they're not around people who are sick, that they're not around a lot of crowds. This is really important right now, since we're right now we're in the middle of a pandemic, so they shouldn't be in large crowds, even large family gatherings, because somebody might be sick and they might not be aware of it. So this person may have no ability to fight off any type of infection. So they need to also be careful what they're eating. They shouldn't eat a lot of fresh fruits and vegetables, because that can have bacteria on it. So only cooked things. They even, just be careful where they go. Be careful around small children, because children can carry a lot of infections. The nausea and vomiting is another really tough side effect. We need to be giving them antiemetics if we know that they're going to be getting nausea and vomiting. We usually give them before the treatment, and then as needed during the treatment or after the treatment. But since we already know it's going to happen, we can just, prophylactically treat that nausea. So make sure that you know your antiemetics, the common ones, like ondansetron is a huge one. It's pretty common. Promethazine, prochlorperazine, and then metoclopramide. Those are the big four. Okay, so know what those are. Also for nausea, just think about, what you would tell someone if they have nausea for any other reason. We want to be giving them maybe dry foods, not a lot of cooked heavy foods, but things that are light and easy to eat. They may need to eat more frequently, smaller meals, because a big heavy meal may trigger that vomiting. If there's any bad smells in the room, get rid of that beforehand. Just think about if especially if you've been pregnant before and had nausea, all of the little things that you do to prevent that nausea from happening. They may be very fatigued, and that could be from the nausea vomiting. It could be from, the anemia. That could be a big part of it. They may have hair loss, because this affects rapidly dividing cells, so that includes your hair. So the hair may fall out. That's called alopecia. This particular medication and drug class can be nephrotoxic. So we're looking at the creatinine levels. Make sure that you know the normal creatinine levels. That is something you should know too. If you need to make flashcards for that, go ahead and do that. Liver toxicity is a big one, so know your LFTs. It can be ototoxic, so when we're doing our assessment, we need to ask them if they're having any kind of ringing in their ears. That might not be something that they think of telling us, but if we find that out, then we need to let the treating physician know that is happening. It's possible that after treatment this person may become sterile. That's just probably one of the risks that we have to take in order to treat this cancer. Hemorrhagic cystitis, so ask them about their urine output, especially because it's also nephrotoxic. Urine output, they should be urinating at least 30 milliliters an hour. And what is the consistency of the urine? Does it have any blood in it? And then also, since it kills rapidly dividing cells, all of the cells in your alimentary canal are pretty rapidly dividing. So they may get mouth ulcers, throat ulcers, they may get ulcers down their entire alimentary canal, so stomach ulcers. So be aware of all of that. That can be a really painful side effect of that. So, they may need to have a lot of good mouth care, hydration. They may need a soft bristled toothbrush, not only because of those mouth ulcers, but also because of that thrombocytopenia. They may be at risk for bleeding, right? They have a low platelet count. That really puts them at high risk for bleeding. So soft bristled toothbrush. They need an electric razor if they're shaving. We don't want any kind of straight razors or safety razors that can really put them at risk for nicks and cuts. Also with the pancytopenia, that thrombocytopenia, they shouldn't be playing any heavy contact sports or anything that can cause bleeding. If they're a high fall risk, we need to be careful that they've got their walkers if they need it. They don't have throw rugs in the way. They don't have small animals tripping them over. Because even a small fall could trigger a hemorrhagic event that would be really difficult for us to stop if their platelet count is really low. So the next category is the cytotoxic anti-tumor antibiotics. So this also works at many different phases of the cell life cycle. So you can see a lot of these are very similar, the pancytopenia and the hair loss. This can also cause pulmonary fibrosis, so we're doing a really thorough assessment of their respiratory system. If they have any trouble breathing. This can also cause like flu-like symptoms, so think the fever, the malaise, the fatigue, that can all be a part of this medication. Of course, nausea and vomiting, liver toxicity, so we're looking at LFTs, cardiac toxicity. So if they are on telemetry, we need to really be watching that closely to make sure that they're not having a lot of PVCs or arrhythmias. And then also the mouth ulcers again. The anti-metabolites, these are pretty common. They interfere with the S phase of cancer cells' life cycle. So again, a lot of similar side effects. So the nausea, vomiting, and diarrhea. Pancytopenia, GI bleed. So we need to be asking them what their stool consistency is and the color. Is it dark? Is it black? Or is it bright red? So, depending on where the bleed is occurring, it will tell us, we can see that in the stool color. So if it's a high GI bleed, it may be digested blood, which turns black in the stool. If it's a lower GI bleed, it might be bright red. So this is also reproductive toxic. So again, it might cause sterility. You may see conjunctivitis, so make sure you're checking their eyes. Flu-like symptoms again. We may have that uric acid buildup in the joints, that gout. So their joints might become inflamed and really painful. And then pulmonary edema, so checking their respiratory system, and the mouth ulcers. So a lot of taking care of cancer patients is taking care of the side effects of the treatments of cancer. So hormones and hormone agonists may be something that we give for hormone-related cancers. So cancers like breast cancer and prostate cancer, for example. They block hormones or prevent the release of hormones. So think about, things that are related to hormone, like lack of hormones, like osteoporosis. You may see some of those types of symptoms because we're kind of putting them in that on purpose. So we may have a loss of bone mass, liver toxicity, cardiac toxicity. So all the things we just talked about. You may see some abnormal vaginal bleeding. You may see hypercalcemia. So know the symptoms of hypercalcemia. So our normal range for calcium is 8.6 to 10.3. So hypercalcemia, you may see bone pain, nausea, vomiting, muscle weakness, right? You may see some cardiac changes. So monitor that telemetry. They may have muscle and joint pain. Sexual side effects, there may be a decreased libido, with some of these treatments. Gynecomastia, which can be a really concerning side effect, especially for men. That can be pretty upsetting. DVTs, PEs, and strokes. So we're looking for those things. Hot flashes, nausea, vomiting, flu-like symptoms again. Biological response modifiers, they increase your immune response. So they kind of boost your immune system to try to fight off that cancer, to get your body to recognize that this is not normal and we need to fight it. But you have a lot of the same side effects with these two. So the flu-like symptoms, fatigue, pancytopenia. Difference here is the neurotoxicity. So we're doing a thorough neurological exam. All those things that you learned in UR 170 apply here. The checking all of the nerves, cranial nerves, remember that. Depression is a side effect, and anxiety. Antimitotics, as you can probably tell, stop mitosis. They inhibit the reproduction of the cell. So we're seeing alopecia for sure. Extravasation is a major concern for this because it can be really damaging to tissues. So this is going to be given probably through a large catheter. Usually people, if they're getting this, they will get a port put in, because if it leaks out of the blood vessel, it can cause a lot of tissue damage. It can cause that tissue to die. So we really need to monitor them closely when they're getting this. And the allergic reaction is another major concern with this one. So they're probably going to be getting this in some type of infusion center where we're going to watch them really closely, especially the first few doses, to make sure that they're not having an allergic reaction to it. So radiation is usually given in combination with chemotherapy. They work together really well. It can be localized just to the one area. If there's a certain area where the tumor is, we're trying to shrink it. We're trying to prevent it from growing, eradicate it, or we may be giving it as palliative care, so maybe not necessarily as a cure, but to increase their life expectancy and the quality of life. So radiation, we usually think of external, and a lot of times it is. You'll see that they may get temporary tattoos put on so that we know exactly where that radiation is going, and we're doing it at the exact same place every time. So if they have that, we need to make sure that they're not washing it off. It could also be internal, which is called brachytherapy, or systemic, right? So we can give radioactive medications. Immunotherapy is kind of a new concept. There is a video, should be on D2L, about monoclonal antibodies that really explains it well. That's another treatment that we're also doing for COVID now, so it's important for you to know what that is. And there are also cancer vaccines available that treat cancer. This is kind of a newer field. So surgery is one cancer treatment that we may be able to do, especially if there's a tumor that has pretty clean borders. Hopefully we can just remove that tumor and get all of the cancer cells surrounding it. We may do it diagnostically, so we'll remove it and then we'll take a look at it, or it may be palliative, just to make the person more comfortable. If there's a tumor that's pressing on an organ or making them uncomfortable, then we may get rid of that. Like I said, the big thing with cancer care is treating the symptoms of the cancer and the cancer treatment itself. So you're a nurse, right? You think in terms of holistic care. So not just the physical symptoms that the person is experiencing, but cancer is very emotional, very stressful for the patient and for the family. So we need to think about all aspects, physical, emotional, spiritual, sexual, all of those things. So we want to make sure they're getting proper nutrition.